online and face-to-face, as well as community workshops that result in more personal interactions and personal guidance as well. And he's going to talk about some of the things that make it more difficult for him to do this work so that you have a realistic idea of what you might be getting into or of what kinds of challenges that you might face if you're doing this work, or maybe you have some ideas for us about how to address some of the challenges that he does face. And then give you some more resources, information about prep, and information about how you can be a navigator for others, or if you're here because you're interested in prep yourself, information to get you the resources and help you make the decisions that you want to make for yourself about prep. And I wanted to point out too, as I said before, Mario is a volunteer. You can do this as a volunteer. I'm here in Memphis. My colleague Rodriguez Harris is going to be helping to develop a professional navigator opportunity, and so we're actually going to have some people around the city in Memphis here who are going to be doing this as their day-to-day job, which is great too. Around the rest of the state, we're working on finding ways to help to educate other folks who might want to be volunteer navigators. So there's many ways you could use the information, the resources, and the steps that Mario has put together. You could use it professionally in your organization. You can use it as a volunteer. Maybe it's just going to help you to get on prep yourself, and all of those are very legitimate and valuable goals. So I hope that you get as much out of this presentation as I have out of working with Mario, and I am very, very happy and proud to introduce him now. So thank you, Mario.
Thank you. Thank you, Catherine. Just to get a little feel for my group here, would anyone like to care to volunteer that they're a prep user or a prep consumer? So we've got one or two. Do we have any clinicians or care-based organization people here? Very good. Okay, I just want to get a feel for the population that we have here today. Any trans, anybody who identifies as transgender, because we do address this, and we also address heterosexual in this, even though heterosexual is not part of what we're doing here, but this methodology can be used for that too, and I'm going to show you that. So, when we look at the AIDS epidemics, let's go from the 1980s. Give me your input. How did people hook up?
Chat lines, bathhouses, cruising.
Okay.
There was like a physical realm where you actually had to go out and engage.
Right. Absolutely. So what I've sort of put together here is sort of my thoughts. In the 70s and 80s, people went to the bars, the clubs, the trails in the woods, the bathhouses, personal ads, and bookstores. Not really a lot changed from the 80s, but in the 90s we got some chat rooms going. AOL chat rooms. That's actually how I met my husband 20 years ago, was in an AOL chat room, believe it or not. So in the 2000s, we pretty much had the same thing. A lot happened in the 90s, certainly in the Atlanta area where I was down. The police were cruising the trails and stuff like that, so they were doing these arrests and stuff like that, so the trails sort of became taboo. People went to the bathhouses, and they still use the chat rooms. But then what really has changed with hookups, in my opinion, since 2010 is really the smartphone apps. And these are the dating apps, the hookup apps that we're calling them. So just want to give you like a brief history, and I think that's where we need to meet our at-risk population, is in these forums. So the smartphone apps make it very easy. This is a typical screen off an Apple iPhone. There are many different types of smartphones, but pretty much a lot of people have the smartphones these days. So you can go to the App Store and you can look up for these hookup apps, or you can type in dating app, or you can type in a whole bunch of things. But I'm going to give you a list of the most common and most popular ones, certainly here in the Tennessee area, that people are using. This is a screen of essentially hookup apps. There's like 16 or 17 of them here, and there's even some down here that I haven't even put. But as you can see, some of them are very targeted towards certain demographics and certain populations. Scruff, for example, would be for a leather group, possibly. Growler would be for a bear group. Grindr is sort of an all-inclusive. Jacked would be a very common site for African-American and people who are looking for people who are African-American. Adam for Adam, Hornet, Daddy Hunt. VGL, I had to figure out what that was. Can anyone tell me what VGL was?
Very good looking.
Very good looking. So it's a very preppy, not to use a pun, but a very preppy crowd that goes into there. And then I've also put Tinder in here. And Tinder, as I've listed it over here, is for mostly heterosexual. But what's interesting about the methodology that I'm going to present to you today is that what I'm applying to these other apps could also be used in Tinder for getting a message out. Because in Tennessee right now, I think about 23% of the new HIV positives are heterosexual women. So don't look past this as an opportunity to just deal with MSM when there's opportunities in other areas. Yes, sir?
So I've just put all the biases out there right now so I can have a good conversation. So I've used Tinder before. And I think the interesting thing about Tinder is you have to sign in using one of your media platforms,
Okay.
either Instagram and or Facebook. So based on the algorithms used through Facebook and Instagram, you'll find other gay people.
Yes.
So literally after the first 5 swipes of no to women, okay girl, we see what this is going to be, and they'll give you all men.
And they direct you where you're
right.
going with that.
Yeah, so I think that's an interesting piece that prevention workers may not realize.
Right.
Yeah, so.
Thank you for that. Thank you. So basically there's the hookup apps. Now, Grindr, Grindr, we worked with back in 2012 in doing banner ads. We put our MSM, which stands for the Men Who Have Sex with Men Task Force, funding into advertising on this because we saw it as an opportunity to get a message out on prevention. And this was kind of before PrEP really came on our radar. But we spent some money on doing these little pop-up ads. And our message was, if you want to know what his HIV status, click here. And then they click there, and then they take them to our website, and we said, well, we don't know his HIV status. That's the whole point. So go get tested, all that sort of stuff. So, but what's happening now with banner ads is that the companies, Grindr and Growlers and all that sort of stuff, they're doing their own sort of awareness messaging, which is really good now, because we don't have to put our dollars in there anymore. They're talking about PrEP, they're talking about ask the doctor about PrEP, and they're talking also about PEP, which is really good. So I'm going to come back to these banner ads later on in the presentation when I show you how you can use that to engage the communities and so forth. But I just wanted to show you that these apps are doing their own work right now in prevention messaging. But the problem with these banner ads is that they don't reach the individual where the individual is. They give you general information, but they don't give direct access. They don't tell you where to go to find a provider. They don't tell you how much it's going to cost or what coupons you can get, so forth, and how to get them. They don't tell you whether or not you have insurance, or if you don't have insurance, what path you've got to go. They may talk about side effects, but they don't necessarily give you up-to-dates on how to manage them and so forth. And they don't necessarily address stigma and shaming. And they don't tell you what to expect once you start on PrEP. So these are the barriers that I saw with the banner ads that the companies were doing, and I felt that there was a need and an opportunity for us to go in and use these apps to our advantage. So, step 1, create a profile. I've named myself PrEP Tennessee, PrEP TN. I've got a picture of myself there, it's got some information about me, and then I created a profile. It says my name, it says I'm HIV negative, I'm using PrEP, it says that I don't work for an agency, and I'm just a volunteer, I'm doing this because I'm doing outreach. It talks about my workshop. I've got a 1-hour workshop that I can be glad to present to you or your organization if you want to talk about it. I've got information on drug assistance programs. This is just a basic profile that I have, and anyone who clicks on my profile can read that information.
All that will come up?
All that will come up if you scroll. You just go there and you just tap up there and all that will come up. Some people have got really long profiles, believe me. But I wanted to put as much information on there as possible. And the beauty about what I'm doing right now is that I've got the same profile on all of these apps. So there's a consistency across the board there. And these are examples of some of the apps. You're actually in the program right now, and this is a Scruff, and you can see there's my profile there, and it lists you in distance, in order of distance, how far you are geographically from the next person. So I'm number 1 listed on all 3 of these particular apps. And what's interesting is that if you touch an app, you'll open up a person's profile, and you can read their profile. And sometimes these profiles will say, because they allow you to fill in information about yourself, that they're on PrEP. or they may say that I'm HIV negative, or they may say I'm HIV positive. So there's a lot of information you can get by just clicking on an app. Yes? There we go. We're good. Okay, sorry. So I just want to show you how the apps are. And what's also interesting is that if someone views my profile, I can hit one of these tab bars down there and hit viewers, and I can see a list of who's just looked at me recently, and it gives me a time of when they've looked at me and so forth. So I get a sense of someone's read my profile. Maybe I can have a conversation with that person. So these are just three examples of some of the many apps that I've shown you there. So let the engagements begin. So just like a message on your phone, you get a message, a notification that someone sent you a message. And then this message goes into a chat area of the application. And the applications are tracked by the dates, so you can see the dates, who the person is, and it keeps a little bit of the conversation there so you can open it back up. So it's really good for tracking your conversations. So the conversation since 2013 to about 2015 went very much from what is PrEP to how do I access PrEP. So the banner ads that we saw earlier are giving people information. They're becoming familiar with the word PrEP. They don't necessarily understand it all. They know it's out there. They kind of know it's associated with HIV prevention. So there's a bunch of standard questions that I get. Since I arrived in Memphis, I've had 5 or 6 people ask me what is PrEP on these apps. They just say, what is PrEP? I see that. So what I'm able to do is in my notes, and most phones have a facility for you to store information, whether it be a document file or something like that. So in my note file, what I've done is I have created a PrEP file, and I've got, in my PrEP file, I've got all these answers, standard answers, that all I need to do is pretty much just copy and paste them. So it doesn't take up a whole lot of my time. For example, when somebody asks me what is PrEP, that's my standard answer. I copy and paste it, and I drop it into the conversation. It takes me 10 seconds of my time to do that. Like Catherine said before, I'm a professional land surveyor, so I'm sometimes out in the field on a construction site. I'll get a little buzz on my phone. Someone's asking me what is PrEP. I don't have to wait till the evening. I can just copy and paste it. It takes me 10 seconds. I'm done. And then they may probably follow up with another message. Or I can go back and follow up with them, say, can I help you any further? So using the notepad center of my phone, I'm able to keep all my navigation tools. Like if I want to send someone a link to a drug assistance coupon, or if I want to send someone a prescriber guide, or whatever it is, I've got all these. This is not information you need to know right now, but I've got this information, we're glad to share it. And all I need to do is like copy that, paste it into my conversation, and again, it's not taking up a whole lot of my time. I also have a list of prescribers in my area. I'm in Southeast Tennessee region, which is near Chattanooga. So I keep a list of the doctors and prescribers. So if someone says, I want to see a doctor, my doctor won't prescribe, I've got a list of doctors that I know are accepting new patients, are culturally competent with dealing with folks that are MSM or trans, and will assist them in accessing PrEP. What is also, and I should bring this up at this point, is that being a PrEP navigator affords me the opportunity to work with the state and work with other navigators in the state. So I have a database of not only my area, but of like Knoxville or Memphis or Nashville, around the state. And as we find more providers, we're adding to that database. And that's what Catherine was alluding to earlier when she said that we could use your input. If you know doctors that are prescribing, let us know so we can add them to our databases. So I also have a little note that I put about PrEP shaming or stigma. If people ask me questions that are sort of saying, oh, you're just promoting a drug that's going to just make people drop condoms and it's going to create STIs and stuff like that. So I address that with, I'm not going to read all this to you, but it's basically just a little blurb I have, or a blog, and I put that information and I copy and paste it, and it sort of opens their eyes, you know, that you wouldn't shame someone who's going on the pill. You wouldn't shame someone that's putting a condom in their pocket. So why shame someone who's taking a pill? They're all looking after their health. So that's pretty much just what that is. But I just want to show an example that this is what I have in my standard set of answers that I can address. And you can tweak these. Once you cut and paste them, you can personalize them a little bit. But it saves me a lot of time. So I want to go over just a few, about 15 or 20 typical engagements so you can get a sense of the types of questions you can expect to hear from people that are looking to get on PrEP. So what is PrEP and how do I get it for free? That still comes up even today, and even though we've progressed on to how do I get it. Here's an example of someone, spoke with a primary care doctor, she doesn't know anything about it. So we're finding out that people are going to their doctors, but their doctors are either referring them to ID drugs or to the health department because the doctors don't actually know enough about it. So what we're trying to do is, what I try and do in my navigation is encourage them to go back to their doctor with the prescriber's guide because their doctor knows their health and should continue working with their health rather than sending them to a new doctor to prescribe PrEP. This is someone who is gay and on the hookup apps and said, you know what, I don't even know anything about PrEP. So I mean, there's still a lot of loose information out there in the gay community, in the MSM, the bi and the trans communities that don't have a lot of information on PrEP. So we need to work on that. So next question is, how do I access getting onto PrEP? This person here, their doctor thinks it's a good idea for that person to be on PrEP, but wants to know more about the drug information. So he's looking to the consumer to sort of feed me, can you tell me what drugs are out there right now so I can research them for you? So there's a doctor actually working with someone. This is a very interesting case. Mr. Andy came down from New York to Tennessee. New York expanded Medicaid. Tennessee didn't. So he was on PrEP for 2 years, comes down to Tennessee. He gets in touch with me about 10 days before he's about to run out of medicine and in a panic saying, what can I do? I can't afford to go get my blood drawn. I can't afford to see the doctor to pay for the doctor's fee. What can I do? I didn't have an immediate answer and I had to scratch my head. So I worked with other PrEP navigators in the state. I worked with Catherine here in front and we put our heads together and we came up with a solution that actually worked for this guy. And the solution was, can anybody interject here what you think we can advise someone to do that has been on PrEP?
Report on the Affordable Care Act. If he qualifies, AC, one of the health exchanges insurance plans should be able to pay for it. And if he needs any help with the patient assistance programs.
But he still has to get the script. Getting the drug is not the issue for him, it's getting the script and the blood work.
And did you say you referred him to?
I haven't said anything yet.
Oh, okay. I'm sorry.
Yeah, so I'm looking for input. It's how would you, what thoughts do you have on helping this guy get access to his script?
I would initially send him to an ID physician or.
But he still has to pay for that.
I thought he said he has
For
insurance.
me here, I would probably send him to a clinic where I know they will draw the blood, send it off to the lab, and they have a scale. So something
Right.
that's
So
affordable.
federally qualified healthcare center. Right. That's a really good answer, and that's the direction we hope to go on. But unfortunately, a lot of the FQHCs, federally qualified healthcare centers in Tennessee, don't know the protocols.
So we have one for sure.
Where is that?
I was going to say, I would send them to Resurrection Health because I know that they're
Right. Right. Okay, so that is one solution. Let me tell you how this actually played out. What we did was we asked him, would his doctor write the script for him up in New York if he got a negative HIV test? And the doctor said he would. So then the doctor just sent the script down to the pharmacy down here. And, or I think it was through the patient access plan, so we got the meds mailed to him directly from Gilead. So that wasn't the issue, but that was the solution, was to use his original doctor up in New York and get free HIV test at the health department.
But then that opens up a conversation around the practices of the health department. Are they using fourth generation testing?
Right.
Is he actually receiving quality STD testing at all 3 sites?
Right. This was a short-term solution so that he could continue his medicine without running out. There is a long-term issue, and his long-term issues go far beyond you know, what we could do in Tennessee, and we certainly will have to start the navigation process again. But we were able to do a short-term fix for him, and that's essentially.
We are doing fourth generation testing.
We are doing
all of our health departments.
yeah, all the
And
health
I'm saying
departments.
frequent testing.
Okay, thank you.
So the availability was there to hopefully satisfy what the doctor was looking for in New York. This is a couple who wanted to get on PrEP, so they were obviously an open couple. They wanted to get on PrEP, so they were asking about that. This is a person who was talking about, and he wasn't able to explain very well to me what was his issue. And what it turned out was his issue. He kept on talking about $6,000. $6,000 was his deductible on the insurance plan that he purchased. So he wasn't able to figure out how to get the drug once his deductible was paid, or once it was. What he didn't realize is that his deductible had to be paid first before everything became free. So I was able to work it through with him. But just to get him to understand what was happening, brought to light that there's more education needed in the community, not just on PrEP, but also about the Affordable Care Act, which we're going to get into here very shortly. This person, TA, went through the navigation process, got him on PrEP. He was all excited, and he says, what can I do now to help other people? So I simply recommended, put in your profile, ask me about PrEP. And so if people ask you about PrEP because you're putting there, I'm on PrEP, ask me about it. If they ask you a question you don't know the answer to, refer them to me. This is a person who is asking, can he go to the health department? He has a doctor, but wanted to go to the health department. So I got into a little bit more with him. And he was a 19-year-old who was on his parents' insurance. His parents were very good friends with their primary care doctor. Didn't want to go to his primary care doctor because he didn't want to come out or be outed. So he was wanting to know what his options were. So I'm just giving you examples of what you can expect. And these are things that I never even expected over the years, but these are things that people ask. And this is a person I've also navigated onto PrEP, and I was telling them I've got tips for you at the end of the year, what to do to make sure you stay on your meds and make sure you get them free next year to use your coupons. So, and he's just demonstrating that you've made the process very easy. And I don't know if you can see up here, but this says January 30th. On May 31st this year, which was a couple of weeks ago, is when I got notification that he got on PrEP. So that navigation process took 4 months. By the time he went to go see the doctor, get the script, that whole process took 4 months. And I was able to track that using this methodology. This is someone wanted to know, could they go to a walk-in clinic? And walk-in clinics would be similar to the FQHCs, I think, what you're talking about, if I'm not mistaken, would that be right? They're federally funded. Right now, if we can work with a walk-in clinic, then yes, they can, but we haven't been able to work with the walk-in clinic because of the lab works that need to be done and the cost proportion of that. So that's something we need to work on. This person here is saying, I can't use condoms, can you help me get PrEP? So not only can I help him get on PrEP, but I can also educate him that there are other options, condom options beside latex. So that gave an opportunity of a prevention message there. And this person was in Brentwood, which is in Nashville, which I'm not familiar with. This person was talking about wanting PrEP access and could I find him a prescriber in Brentwood. And like I said, because I've got connections with other PrEP navigators in the area, I was able to send a text, who have you got in Brentwood or who have you got in the Nashville area? They sent me a text back. I was able to get them hooked up with a doctor. And then the question is, do insurance plans cover it? This is an engagement about condoms, and this engagement was a very long engagement. It went on for a very long time. It started off with condoms, and it went into stigma and shaming and saying, I don't think people should be on PrEP at all. It's just giving them a free ride and all that sort of stuff. So you have to expect that kind of engagement. Did you have a question?
No, not yet.
Okay. And this is just someone just affirming that this worked for him. This is a good job. And thank you very much. So, what this methodology does with the chats being stored is I can keep track of my engagements. I can keep track of everything. I can tap on somebody here, and we go back to January or February when we started conversations. And it's also very good if I need to refer to advice I gave someone that I couldn't remember. And I can apply to someone else, so I can copy and paste answers there if they have similar questions. So keeping track of engagements is very easy using this method. So in December of last year, people were shopping for insurance. And then they were asking me, through these apps, which insurance plan should I get? And of course, I'm not an Affordable Care Act, ACA, or an Obamacare. I'm not an expert in that. I don't have I don't have the knowledge in that. I can learn that, but I don't have the knowledge. So we developed a 1-hour workshop which addresses pretty much everything people want to know about PrEP. How do I get it? How do I access it? What's the side effects and so forth? And in that 1-hour workshop, we also incorporated the Affordable Care Act so that people could help choose a plan back in December so they could get on the right plan for PrEP. So invitations were sent out on social media, Facebook, and using the hookup apps. Remember we talked about the banner ads at the beginning? Well, we paid for some banner ads saying, hey, look, we're going to have a presentation coming up in a couple of weeks. Why don't you come join us and learn about PrEP and learn about getting the correct insurance? And these banner ads are like 20 bucks or less. They're not very expensive. And free individual advertising. I'm going to show you about free individual advertising. So basically, in my PrEP notes, I've got information about, this is a workshop that we did in Knoxville. So what I did is just copy it. And then in Growler, I purchased what they call a shout. It reached a 20-mile radius, and it reached 247 people. So we were able to copy and paste that in Growler, spend 10 bucks on that, or 20 bucks, whatever the cost was, and we were able to get people to come to the community workshop. As an individual, you can click on an individual's profile. It brings their profile screen up and their chat screen up, and you just insert it in theirs. Hey Rick, I've got this workshop. Rick happens to be very prominent in our LGBT community. He works with a lot of different communities, and he was able to get the word out, so he was able to spread our network in reaching more people for our workshops. And then the workshop we were able to put up on Facebook. Just basically we're saying, we got this workshop coming up, and then all of our friends, we encouraged them to share that information, so that also got people to come to our workshops. If we had more time here today, if we had a 2 or 3 hour presentation, I would actually present the workshop so you can see what we talk about in those workshops. But what we're talking about right now is how you can use these hookup apps to engage the community and invite them to an event, essentially. So, what are the limitations to using this? Anybody?
I was going to say, you're on a hookup app?
Yeah.
So you may get flagged. And
Yes.
when you get flagged, your profile will be deleted.
Yes.
As well as if you're not paying to do advertisement, they may call it soliciting, so
Yes.
they will block you.
Yes.
So
Adam for Adam has blocked me. I can't tell you how many times. Adam for Adam blocks me all the time. And what I essentially do is, I got mad at them first because I was saying, like, I'm not advertising, I'm not looking for money, all I'm trying to do is educate. And so what I do is I create a new profile, but I change it slightly. Instead of PrEP TN, I'll put PrEP 2 spaces TN, or PrEP _ TN, or PrEP Destiny. So I've got a few left, but you're absolutely correct. They'll flag you. What other limitations?
I can only imagine that you have an issue with follow-up with people that you engage with the hookup apps, like you may not know if they actually went through.
Absolutely. Right.
Going to do PrEP, or even if you know that they went to get PrEP, you don't know if they're continuing
Right.
on PrEP, and
Right.
they're not engaging with you through the app.
There's no continuum of that prevention. Absolutely, you're correct on that. And being a volunteer, not doing this full time, this isn't my job, I have even less incentive to follow up. Although I do follow up, but I have less incentive to do that because it's not part of my day-to-day job.
Right.
So
So it would be awesome for, like, when you give presentations and you have to say, I followed this person,
Right.
you know, for a year or something like that, just
Right.
to show that it works.
Also, because you're on a hookup app, people are going to not necessarily read your whole profile.
Correct.
They may just like what they see and then,
Move on.
hey, here's some news. Hey,
Right,
here's this.
right.
And then,
So what I can do is, let's say for example, I was 2 days ago, I was in Jackson, and I was doing my community workshop. So what I did was, rather than have people read my profile, what I did was I went into everybody's profile, copied and pasted my little workshop thing, and I put it in an actual message. So I got a message. And then I got blocked. But it's good for a one-off thing, you know. I got about 35 out before they blocked me. But okay, but not all at-risk individuals are on these apps. So that we need to recognize that just not everybody's on these apps. So it's not a one solution system here. Navigation for assistance for the uninsured is very limited here in Tennessee. It's not so bad here in Memphis, but around the rest of the state, if you're uninsured, access to PrEP is a barrier. Navigation can take several weeks, as I've described earlier, so the risk of losing one through the process is what you're talking about. However, I do actually randomly, like in the evening time, I'll just go through my phone and I say, I haven't talked to him in a while, let's see where we were. I could read through the conversation. I'll just send him a text, hey, how's it going? And just start a conversation again, see how it goes. So I do follow up in a lot of cases, but you're absolutely right, people can be lost through this process. Navigators who aren't MSM or trans or are not on PrEP, there may be trust issues. So for example, if you were to set up a profile and put it on Grindr or something like that, maybe men who have sex with men won't talk to you about that. So that may be a trust issue. So I wouldn't deter you from doing that, but what I would suggest, let's say if you were going to create a profile, that you create a group picture with you and a few of your friends, so that you're not trying to pretend that you're a gay man that's on these hookup sites for hookups. Right. So you're actually being honest with them. So these are things that you can do to get around that, but these are still barriers. And navigators need to be available for assistance off hours. Yeah. So essentially, people come home from work at 7 o'clock, they're not doing anything tonight, let's go on the hookup app, let's see who's around, whatever like that. So you sort of need to be around to answer questions at that time. I sit in front of the TV with my my smartphone. I have a thing where I said earlier where I copy and paste my answers because I've got thick thumbs and stuff like that. No autocorrect. It is never ducking. Right. Okay. So, but in front of the TV, I'm able to watch a show and I'll get a message coming in. I'm talking about that, and so you need to be available off hours. We sort of discussed this about what other challenges do you see at the start. So why talk about the ACA? Because the ACA is very important for people living in Tennessee. Because if you don't have insurance, PrEP access is a barrier. And that's why I'm going to introduce you now to Kathleen Jeter, who is a ACA, which stands for the Affordable Care Act or Obamacare. She is a navigator in our area. And she's an expert in our area. She's paid to do this. So when I partnered with Kathleen, I was able to learn about the ACA, and I was able to invite her to our workshops. So that not only did I have me talking at the workshops, but I also had people who were experts in the field. We were also able to bring physicians in the workshops, and having Kathleen made everything so much easier. And I'm going to let her talk now for just a little bit. So Kathleen Jeter here. Thank you.
It is always a pleasure to stand up in front of a group of individuals to talk about what I love to talk about, and that is access to health care. To me, insurance is just one component, but the biggest thing is getting people linked up to the medical services that they need and should deserve to access. So as Mario stated, he contacted me as he was doing the community workshops and said, hey, would you mind coming out and talking a little bit about why ACA is so important when we talk about the PrEP? And of course, I agreed. So today we're just going to kind of cover a few things about the ACA, not go in depth. Many of you probably already know a lot about the ACA and navigating that system. What we're going to discuss is why does an individual seeking PrEP need insurance? What can an individual, when can an individual purchase insurance, Understanding the different federal poverty guidelines that are in place with the state and federal exchange systems, the marketplace. Choosing the right insurance plan, which is really crucial when we talk about accessing to care, whether that's PrEP or the lab works or anything like that. The importance of an ACA navigator working or networking with a PrEP navigator and kind of the relationship that Mario and I have in the Southeast Tennessee region. So why does an individual seeking PrEP need insurance? I think Mario really set it up well. I mean, when you talk about the use of PrEP, we have to look at the issue of whether a person is insured or uninsured. And if they are uninsured, how do we get them the access that they need? Getting to a provider, getting that script wrote, getting the necessary routine labs that they will need ongoing. So in Tennessee, access is limited. This is, when the ACA was passed, many of us were very excited that for the first time in our history, nation's history, many folks will have access to affordable health insurance. Unfortunately, a lot of that changed here in Tennessee in terms of our legislators, our state legislators, not expanding TennCare and Medicaid. So it really has made it a challenge for us as health professionals to help individuals in the community access any type of medical care. So cost to see a prescriber, cost for the HIV testing, the required lab and blood work, and then that ongoing process after that. So when can an individual purchase insurance? I think this is something that requires us, even outside of talking about PrEP, is that we've got a lot of education that we still have to do in terms of educating people what the ACA is, who does it benefit, how they can access the marketplace, when can they access it, are all education points that are still happening ongoing. So open enrollment to obtain insurance for this year ended towards the end of January. So right now, we do not have an open period of time where individuals can go in the marketplace unless they qualify for like a special enrollment period. And special enrollment periods are things like qualifying life events. You move from one state to another state, or even sometimes you move from one region to another. So in instance, if somebody from Memphis moves to Chattanooga, that may trigger a life qualifying event and give you a special enrollment period. So these are things when you can purchase insurance. One of the other key parts of the Affordable Care Act was utilizing the federal private levels. Federal private levels have been around for a long time in terms of our Medicaid and our CHIP programs and other non-healthcare related programs. So this is not something new, but I think it's new and challenging to the world of getting insurance for lots and lots of people in our communities. And the reason why is the state and federal marketplace systems use these guidelines to see what an individual or household of individuals, how much that they can qualify for assistance. So when we look at the marketplace, we start with what is the household income. That is very important when we talk about insurance. Before we get to even talking about the right insurance plan, we've got to know what that individual, what that family household would qualify for. So as you can see, for a family of one, if their annual income for 2016 has to be at least or more than $11,770. What's significant about this is not necessarily if they're at that level or above that level, is if they're below that level. So in Tennessee, many of you guys know, again, we did not expand our Medicaid program. We don't have Insure Tennessee yet. So if a person is even right below that figure, their landscape of options drastically change. So that is probably the key thing. For a family of two, you see it's $15,930. One of the other significant things that I'll point out is a lot of people think, oh, you have to be very low income to qualify for assistance with insurance. That is not the case. One of the great things about the Affordable Care Act is it goes all the way to 400% of the FPL. So we want to encourage people that even have a modest or mid income range that they can possibly get assistance on the marketplace. However, you've got to keep in mind the more you make, the less assistance, the less you make, the more assistance. So understanding the different plan levels, there's really three things when I go around and I talk about education when it comes to insurance. There's really three things that I tell people on how to choose the right plan. First and foremost, it's not about what your aunt had or what a friend of yours had. It's really individualized. And I try to tell people when they sit in front of me and they start to talk, well, my friend told me she got this plan and it's the exact same plan that I want for me. It does not work like that. So I really try to educate people to look at themselves and their family members. But the three things is, first of all, you want to look at the metallic categories that are on the marketplace, because that's going to play a significant role in how much you can afford a plan, what the plan covers. The second thing you want to consider is your total out-of-pocket cost. And we're going to cover that, as Mario mentioned, in terms of PrEP. And then lastly, you want to look at your plan's networks. What type of plan is it? Is it an HMO? Is it a PPO? Things like that. So the metallic levels, there are four of them. There's bronze, silver, gold, and platinum. And the metallic levels have nothing to do with the quality of care. We get that a lot, that people think if I get a platinum, that means I'm going to, I don't know, it's a more magical plan than a bronze plan. Has nothing to do with quality of care. What it has to do with Basically, it tells you how much you're going to pay for your services and how much the insurance plan is going to pay for the services. So what is the relationship between you and that insurance carrier? Typically, with gold and platinum plans, the more you pay, the less out-of-pocket expenses you will have. So the higher the premium, very low or even no deductibles, and very low out-of-pocket costs, what you pay at the doctor. Bronze and silver are typically what people gravitate to, simply because they're the least affordable or the less expensive options. Bronze plans, you can get a bronze plan on the marketplace now. We had an individual enroll for less than $5. But when we talk about PrEP, one of the things you have to realize is, one of the things you have to realize is that people start with the monthly premium, and although that's very important, they can't stop at just the monthly premium. So when you guys are working with individuals or you're accessing resources for individuals with PrEP, one of the important things is that even if they qualify for assistance, as this example shows you, even if they can get a bronze plan for $13, which is wonderful, they also have to look at the other cost shares that they're going to have. What is the deductible? What is their total out-of-pocket cost is going to be? This example we use with John, he makes about $17,000 a year, so he's right at 150% of the FPL, which is great because he qualifies for tax credits and cost share reductions on the marketplace. One of the things I failed to mention is that with the metallic plans, if a person qualifies, then they can enroll in the silver plan. It's option, they don't have to, but if they do, they're going to have more enhanced assistance with their plan in terms of what they have to pay. So John, in this instance, let's say he enrolled in the silver plan. These are his options. Again, most people are gravitating to the bronze because that's the cheapest in premium, but they're not looking at everything else. Well, in this example, John chose the silver plan. It's a little bit more in terms of monthly premium, but as you can see, his annual out-of-pocket costs went down. His deductible was much lower under this plan. The thing that Mario has found is when we connect PrEP and the ACA is that there are the copay assistance. So you can get a coupon with the PrEP, what is it, about $3,600. You can use that, present it at you say you have the prescriber has prescribed the prescription for PrEP. You go to the pharmacy, you have your copay coupon, you can utilize that, and it basically alleviates your deductible and your annual out-of-pocket max. So right there, when you leave the pharmacy, you're at 100%. That's regardless of anything. So if he had to have a heart exam or a heart test or whatever, that test is going to be covered. It has nothing to do with the PrEP or the PrEP use. But the significant thing is PrEP is what got him to get him to that 100%. So this is a way that we have really saw that we can educate people on, again, why choosing the right plan matters, especially when we have the copay assistance coupons with PrEP.
That's Catherine's. So thank you, Catherine, for that. So again, we're wrapping up here right now. We do have evaluation sheets before you go. If you wouldn't mind filling those out for us, I would appreciate that. A PrEP navigator needs to have regular counseling from an ACA navigator. So, like I said, working with Catherine really helps the PrEP navigation process. PrEP navigator might be willing to work with you presenting the workshops, and Catherine has worked with me in the community workshops. And how do you find one in your area? If you have one, go to healthcare.gov and search under the local health, and you can find a list of navigators. That's their job, correct? That's what you're paid to do, is to navigate people onto the Affordable Care Act. So if you can partner with an ACA navigator, that is really optimum. And with that, we have a list of resources, which I'm just going to flash through right here. If anybody wants any of these handouts, I'm sure we can make them available to you. These are just the resources for clinicians, resources for PrEP. For most of you already know this if you're involved with PrEP. We have regional contacts here in Memphis. We have contacts in Nashville, in Chattanooga, and in East Tennessee. So if you're looking for a PrEP navigator, we can hook you up with a PrEP navigator in those regions. Again, we'll share this information with you if you like it. And at this point, we have just a couple of minutes for questions. Yes, sir.
So I'll just list. I have like 3 questions. The first one would be: did you capture any demographic information on the people that you had conversations with?
Not per se, just numbers. I have not done any specific navigation with a trans person. However, trans people are using these apps, and I do know that, but I've not had any specific with trans. I've not kept up with demographics either. I could do that. Like I said, I'm a volunteer, so my time is sort of kept up with my business, but I'm sure that could easily be done.
Okay, second question. I saw a lot of screenshots from Growler and Grindr.
Yeah.
Did you actually do any of this navigation on Jack or any of the other platforms?
Absolutely.
Or you just didn't?
I just pulled up the ones that I was most familiar with.
Okay.
Yeah.
And when you did the $20 shop on Growler, you said it touched 247 people in a 20-mile radius.
Yes.
Do you have the number of how many people actually came to that? Maybe
Yeah, I think 5 came in that particular presentation. Oh, that was Knoxville, wasn't it? There was more than 5 at Knoxville, wasn't there? For that?
There were about 60 total, but I don't know how many were.
I'd say there was about 10, but what happened with the Knoxville, I got a lot of people afterwards. I really wanted to be there and I couldn't be there. Could you help me out? And I probably got about a dozen of those. So I would say in total I reached about 20 people with that specific intervention.
And do you see any people, or have you guys began to hear conversations of people traveling down to Dalton to access the PrEP clinic that DPH has?
Yes.
Okay.
Yeah.
Cool. Thank you.
Yes, sir.
2 questions. Did you find that with your profile being so lengthy that you might have to deter people from actually engaging? Because when people are on a dating app, they're kind of looking for very general, specific things and what they're looking for.
Well, what I tried to do is put the very specific information. Let me see if I can go back to the profile. I tried to put stuff at the very start so that people got bored, they weren't going to read it.
Right.
So what I put was basically, if you're at risk for HIV, talk to me about PrEP. That was kind of one of the first things I talked about.
So would you find that you ended up kind of repeating some of those like copy and paste answers that were pretty much in your profile? But
Yes.
Okay.
Yeah.
And the other question I had,
Yeah.
when you actually engaged the workshop, which app or social media outreach worked best to get people in?
Well, that's an interesting question, because the workshop that our goal for the workshop was not just to reach PrEP consumers, but was also to educate either clinicians or prescribers. So we wanted to encompass all of that. So I would say we had really good success using the apps to reach the at-risk population that I was targeting, and using social media, and then the network within social media of like Catherine might know a physician to invite those
So it
people
was
to
like almost
that.
like a two-handed effort.
Yes,
Going to different
yes,
places.
yeah.
Cool.
Okay, so I know that you're a volunteer, and this just goes back to keeping them engaged. So you mentioned that later on you would go through the thread and check up on them and ask them about things and all that. Have you been in any situations where they did not follow up with their plans to get on PrEP?
I'm sure there's people that they wanted questions, they wanted to inquire about PrEP, and they may have determined, because a lot of times during the conversation they will say to me, I'm going to Florida in September and I'm going to be partying at that time, but pretty much I don't have sex any time between now and then.
Yeah,
So is PrEP right for me? Type of thing. So they may actually determine PrEP is not right for them.
Right, okay. So specifically for the people that say they are interested in being on PrEP, would you say that the majority of the time they will
pursue it. They will pursue it with my assistance. I think honestly, I have to hold their hand.
That's what I'm
through the whole process.
That's exactly what I'm getting to, because I'm in a situation now where I'm so hands-on, like I'm in the community.
Right.
Late night at the parties, at the events, and I have great relationships with my population, but if I'm not holding their hand,
right.
and if I'm not taking them to resolution,
they'll stop. As soon as they hit a barrier, they'll stop.
Right.
What I found about this is that they can always come back to me because they know where I'm at. And a lot of it is anonymous, and they want to be anonymous. They don't really want to be out, because I don't know what gender orientation or preferences are and all that sort of stuff is going on. So they may not even want to share that with me, which is fine. I just want to be able to give them the access that they want. So, so I do find that I have to hold their hand through the whole process, and that's why individual navigation is so important. You can't just hand a flyer out and say, here, go get prep, because it doesn't work like that in the real world.
Not even take out.
Right. Okay, I think we're about done for time, so thank you very much for your time. Appreciate you being here. Catherine, and thank you to Kathleen and Catherine.
Folks, I just wanted to let you know Mario has been very generous and is willing to share this presentation if you want any information you weren't able to jot it down quickly enough, or you just want to be able to use something that's already put together. So if you would like to have that emailed to you, actually rip the corner off, but just give me your name and email address, make sure it's something we can read. And we will make sure to get that information to you. Also, we are still compiling a list of providers across the state who either we know are prescribing PrEP or who are willing to prescribe PrEP. We have a small list of people, about 25 or so at this point. We would love to know if you know of anyone that we haven't heard about. So if you know providers who are prescribing PrEP, if you would give me their name, I will contact them, touch base with them, find out what's going on, and ask if it's okay if we put them on the list so that we have more people to refer potential PrEP users to.
Have you updated in state?
Yes, actually a lot. We've almost doubled what we had since they.
I remember we had some people that were looking on the.
Yes, so, and I'd like to come here with